Okay, so now let's talk about respiration. The actual respiration is the actual exchange of gases, oxygen and CO2, within the alveoli and the capillary beds around the alveoli. So here I've drawn a kind of a big alveoli. This is our little bronchiole going in. This is our air exchange, and this is our alveoli. And I drew kind of a little capillary bed on one of them. This is kind of a little cross section with a couple of vessels around the edge. This process is works by a complex hormonal and neural signaling, which detects concentrations of oxygen and CO2 within the blood and acts to alter the amount of blood flow through the capillaries or the size of the smooth muscle around the bronchioles. So as the body needs, it will increase blood flow to the capillary beds within the lungs, and or it will increase the size of the bronchioles, allowing more air to pass to get to the alveoli and more blood to reach the capillary beds for gas exchange, depending on the body's needs at the time and under the circumstances. That's part of this, obviously. Then we have internal and external respiration. So external respiration is what we're going to concentrate on now, and that's the respiration that takes place in the alveoli. That is the gas exchange between the blood and the alveoli, exchanging oxygen to go into the bloodstream, CO2 to come out of the bloodstream. So as this expands, these are little balloons, so these are going to get bigger. So as we inhale, let's use a different color so we can see what we're doing here. Bronchial, capillary, or alveoli are going to expand. They're going to expand out in all directions. Think of this as a three-dimensional. Now, mind you, this is a normal, what we'd consider a normal, healthy individual with no underlying underlying health issues, no, nothing like that. This is just healthy tissue. On a normal, everyday basis, when you breathe, your bronchioles are going to open up, your alveoli are going to open up, your capillaries are going to stretch during this time, your blood vessels, and you're going to have oxygen drawn in. We're going to use green for oxygen because oxygen is always green. Just ask any welder. We're just going to draw little, so air is rushing in. It gets into the alveoli and it swirls around in here, swirls around in here, swirls around. It mixes with the dead space air from an earlier breath. It all swirls around, and you got little oxygen molecules swarming around in here. And we got a rush of oxygen on inhalation. We've got a rush of oxygen going in. We're going to use orange for CO2. And in our capillaries, we have more CO2 or carbon dioxide. We have a little bit, because we do have a little bit in the air that we breathe normally. So now our pressure gradient that we talked about with actual pressure, now we got gaseous pressure. So now we've got a higher concentration of oxygen in the alveoli and a lower concentration of oxygen within the capillary, and vice versa. We have a higher concentration of CO2 in the capillary and a lower concentration of CO2 in the alveoli. So that's going to start to diffuse across. Orange for CO2. Orange is diffusing across. It is trying to equalize this pressure gradient. And at the same time, oxygen is going into the bloodstream. So gas exchange is happening internally as oxygen is attaching to red blood cells within the capillary, the CO2 is diffusing from plasma. A little bit is probably on the hemoglobin, not a whole lot. And it's all diffusing across the membrane from higher concentration to lower concentration. And pretty soon, just before we exhale, so if you think about how we breathe, pretty soon we are more CO2, more oxygen. Now take that tongue-in-cheek, because we know that we're not going to use all the oxygen that goes in, because we are breathing. Atmospheric air is 21% oxygen. And when we exhale, under normal circumstances, we're between 17 and 19% expired CO2 or expired O2. So we're using 2 to 3% of the oxygen that we inhale. So that'll be important later. And then when this happens, or just before we exhale, and all of this, since CO2 is swirled in here with the oxygen, it all rushes back out as the passive phase of respiration or ventilation happens. The alveoli being like balloons. Bronchioles, smooth muscle. All this shrinks back down. Forcing air out, creating that higher pressure within the alveoli, within the physical airway, and forcing it back out through the upper airway and out through the mouth and nose. So now let's talk about internal respiration. So internal respiration happens just like it does in the capillaries and the lungs, except it happens within the capillaries in the body. So here's our red blood cells lined up with their oxygen loaded, and here is our, with green again, because like I said, oxygen is always green. And here is our CO2 loaded cells. So now there's oxygen saturated within the blood plasma as well as CO2. Carbon dioxide is also transported in plasma as well as on the blood cells. So again, we're higher pressure gradient. So this is oxygenated blood coming into the capillary bed. As it comes in, it's going to exchange CO2 and other waste, obviously, from the cells for oxygen off of the red blood cells. So our red blood cells will attach CO2 and it will transport that. It will also take CO2 into the plasma as part of the buffer system. Carbon dioxide in the blood plasma is not a bad thing. And as the red blood cells go back to the lungs through the venous system, They will exchange again in the in external respiration, or in the lungs alveolar respiration. They'll exchange off again, exchanging back CO2 off the cells, and for oxygen and CO2, extra CO2 within the plasma system will be excreted out of the kidneys as part of the bicarbonate buffer system. The cells exchange gas, like I said, in the same manner as the lungs do. It's the capillaries are about one red blood cell wide. The cells line up, go through, they exchange off carbon dioxide for oxygen, and carry it back to the lungs to be exhaled. Extra carbon dioxide within the plasma, again, is part of the bicarbonate buffer system, which we'll cover after a bit. And it's all connected in that way.